So I've got the privilege today to talk you through our innovation strategy. At Bupa, we've asked ourselves a really profound question. We recognise that businesses have faced multi-year double-digit price increases on their healthcare scheme. You're seeing massive increases in demand. You're also doing that in the backdrop of a really uncertain economic environment. So we've asked ourselves the question around how do we harness the unique position that Bupa's in? Being vertically integrated, so managing funding of healthcare, but also the delivery of healthcare, but also having access to all these innovations. How do we change that cost curve so that we can really drive a difference for you? Connected care really does make the difference. Now, in primary care, our ambition is we think that we want to do as much of the primary care stage for our customers as we can. Because when we pick up and we triage or we diagnose a condition, it's much easier for us to really guide that customer through the healthcare journey, remove inefficiencies and complexities that drive up costs and undermine outcomes for that employee. When we improve their recovery rate, for example, they get back to work faster. So not only does the employer benefit from cost efficiency in terms of the healthcare, but you also have them reduce people costs flowing through. We are a very ambitious business about harnessing innovation. One of the benefits from being from a big healthcare group is we get access to things like genomics, but we've got some fascinating insights in terms of what type of outcomes we see from genomics and how we can harness it to make a real difference to our customers. I think we talked about 600 to 700 clinicians working at Bupa on some of our primary care services, up to 1,000 now, 1.5 million primary care appointments. Within that, 1 million GP appointments. We had one hospital last year. I think we hinted that there might be more coming. We've now tripled that to 3, right? And 106 primary care clinics. I think that was about 70 last year. Of that, we plan to have another 40 or 50 mental health clinics because we recognise where there are capacity issues or an ability for Bupa to make a difference. We remain really passionate about addressing capacity gaps, particularly in mental health for young children. And there's a big investment across Bupa to be able to deliver that. So we want 80% of the UK to be within 30 minutes of a Bupa primary care clinic. Everyone in your workplace will differ. Why do we try and provide one healthcare scheme and then provide the same type of healthcare on offer to everyone? We don't think that's right. So one of the things about genomics or the health assessment is we can start to build a risk picture and we can then say to people, this person's at elevated risk at this condition. Therefore, we want to increase some funding for that customer, which would then should mean in the future we see reduced costs as we've intervened earlier. So that personalization and that risk management of employees is a much more proactive approach than we've seen before, where healthcare has been reactive, waiting for something to go wrong. Bluer and our digital healthcare services, absolutely critical to then, once we've understood that this customer's at risk, we can provide a fantastic experience in one side of our clinics or a partner's hospital. But how do we then track the outcome? How do we use coaching and support and guidance to really make that difference to that customer's broader lifestyle to really unlock the benefits of preventative health? The insurance products, how do we then unlock really targeted funding that's very specific to that individual customer's need, with the employer able to calibrate what you think you should invest in based on your investment appetite, and also the needs and dynamics of your workplace. And we're already starting to do that with our well health products in corporate, but we're going to make a significant investment and continued innovation around that space. So connected care, we call the secret sauce of Bupa. You can imagine we're incredibly proud of the difference it can make. So we reward provision based on outcome, not on unit costs or the volume of healthcare that we deliver. And when you bring all of those things together, that's when you can be more cost effective because you're spending in the right way. You can understand and track your clinical outcomes, not just in terms of immediate outcome, but long-term outcomes. So is that customer less likely to relapse? Is that customer less likely to see other healthcare costs coming through in the future? What we think is different at Bupa is you need all 4 of these components: that risk understanding, the digital health services, personalized funding products, and connected care, really working well together to really unlock this advantage.